Well, hello. I think we're going live. We're a little bit late. We got stuck in clinic. Hopefully I'll start seeing some names coming up when you start seeing us. So give us a thumbs up so we know that you're there. I say we. Naomi's just answering the bleep. The bleep went off as soon as we walked into the room. We're on level 6 for a change today. So we've just run out of clinic and rushed up, grabbed a drink and come on to do Facebook Live today. So apologies for being a few minutes late. So I can see you've got one person looking and watching, and hopefully a few more will start joining. And here's Naomi.
Hello.
So she went off to answer the bleep. So,
All answered. How's everybody this week? We're at a funny angle here, Alex.
I know, I'm sorry, but guess what I didn't do? Charge my phone. so it's
We've
plugged
had a really
in.
busy morning.
Plugged in.
We just legged it from clinic. So.
Yeah. So hopefully this is going to start coming on here now, and I'll be able to see. So I can see numbers are rising. Yeah, I can see people coming.
Are you all enjoying this lovely warm weather? It was a hot night last night.
It's a bit grey today though.
Yeah, so hopefully your babies are surviving, and you took the tips that we did last week with you, which was about feed and increasing your milk supply so that you don't need to give your baby anything extra, just lots and lots of breast milk. And some of you may have noticed that your babies are suckling a little bit more than they were before when it was a bit cooler, and you might find that your breasts are a little bit fuller with that as well. So hopefully everything is in hand and all is going well. So what are we talking about today? We've had a busy clinic, and I asked lovely Miriam in clinic today. I said, what shall we talk about? She's just gone, and she said large breasts.
It's often a challenge, isn't it?
So we thought we'd talk about large breasts and breastfeeding. So if there's no questions, then we can go ahead with that. So they're a little bit more difficult to manage. Just because we've got pillow there.
Yeah, we've got pillows.
We've got pillows. So it's just about working with what you've got, and remember that your baby doesn't know anything different. So all you give your baby is what they know. They don't know anything else. And so they will take whatever you give them. Now, just occasionally you find that nipples are a bit too big for a baby's mouth, or baby's a bit small and overwhelmed by it, but normally you work it out. It's not usually a problem. So don't ever be put off because you think that your nipples are too big, too small, too flat, too long, too whatever, to one side. It doesn't matter what your breasts look like, or your nipples look like. All it is putting milk in the baby's mouth, the nipple. The rest is breastfeeding.
Because we always say that no baby is born with any preconceived ideas of what a breast is going to be like.
Exactly.
So your breast is going to be the first breast your baby ever comes into contact with, and probably the only breast. So as far as your baby is concerned, you are the only way they come. They have no ideas about any other sort of breasts. So if anybody makes a comment about your anatomy, whether it be too big, too small, too flat, too this, too the other, inverted, actually your baby doesn't know any of that. Your baby doesn't have a clue. So we just work with what you've got.
Primed to breastfeed.
Yeah.
Primed to feed with what you offer.
As long as we don't interfere, the babies will cope.
Yeah. So there are tips that you can use if you're struggling to breastfeed to make life a little bit easier, so that you can manage larger breasts, because sometimes you can't see what's happening, and we've got a nice big knitted breast here because all breasts are in different sizes. So knitted breasts are also in different sizes, and most larger breasts are this way, so you find that the nipple is underneath, so you find it quite hard to see what your baby's doing because you can't see your baby going underneath the breast. So it's about working with what you've got. One of the things that you can do, and I'm running out of hands now,
yeah,
so you can hold the breast.
Oh, I could have rolled that up.
And then you can get a muslin, so you've got your muslin like that, fold it in half, and then you can roll it up.
Make a little sausage.
You don't have to do it all the way. It depends how big you are. If you've got a really big breast, then you might find you need to roll it all the way. If you've got sort of medium-sized breasts, then you might want to do it about that much. But play around and see. What you probably don't want to do is just get a handful and stuff it underneath, because it gets a bit bulky then. And then you would, if your breasts are down there like that, you would tuck it underneath the breasts, and it tends to lift it up a little bit. And you might find that is very helpful.
And the breast holds it in place. So
and then when you let go, it doesn't go anywhere, and that gives you an extra bit of support. One of the other things that you can do is and it's a bit like a bikini top, you can get a scarf or something which is supportive,
Pretend with that, couldn't we?
And it's not very big, that's the trouble.
I know, we'll
And imagine
pretend
it's
so it
really
would
long, and then you just make a sling like that and tie it around your neck. So it will be longer than this, obviously, but it's like a halter neck. And that supports your breast as well in another way. So that's another way you can do it. So a long silk scarf, something like that, is very handy. And that supports breasts.
We use tubi grip here, so on occasions, because we have L grade tubi grip, which is one of the widest tubi grips you can get. And any of you who may have had sort of the split recti muscles, they might have been given a piece of tubi grip to go on your tummy. But that's the tubi grip we use. We use it to make pumping bras, so it's very versatile. So we do make little mum's tubi grip bras, and we also use it. Holds the pump kits on for mums. But we also use it. It can go around the neck and then under the breast, and it acts as a little sling for the breast, which works really well as well when mums are struggling because they can't see and the breast is pointing downwards.
I'll tell you what, you can do the positioning with one of these, and I'll do the positioning with the doll and baby, so you can demonstrate it at the same time.
Right, okay.
So that one of the positions I think that mums find the most helpful, and what I think, it doesn't matter how big your breasts are, this is the principle that you follow, whatever, and you're working with the angle of your dangle. So the dangle's down here, or up here, or halfway, or over there, or turning in, whatever. You've got to look where your breast lies when you've got it. Obviously I'm holding the breast because it's going to fall off me if I don't. But you need to work with that. And you might find that with a lap sitting up that you don't need cushions or anything because your breasts are big enough to just feed like that. But you will find that going underneath like a rugby ball, same principles. You imagine you're at the hairdresser's, you've got your hand where the sink will be, that's what Alex always says, where the sink will be on your neck to support your baby so they can lift their head back and they can escape if they need to, which is really important. And you're working with where the breast is. So if your breast is up here, your baby will need to be here. And if your breast is down there, your baby will need to come onto the breast where that angle is. And
so
work
you could almost do with this one folded in half, because I can show the different places the breast would be.
So you would support your baby with its tummy facing up to you, so it would be lying on its back almost, with your baby looking up at you, and probably almost on your lap, with its head almost on your lap if you're sitting on a lowish chair, if your breasts are quite big. But if they're slightly smaller, then you might find a pillow supporting you will help. But it's about, your baby will take the weight of the breast on its chest. It sounds worse than it is. It does support the breast. It doesn't fall off then out of the baby's mouth with the weight of the breast. And I think that's what mums find more, is that if they're doing it across their tummy like this, the weight of the breast sometimes falls out of the baby's mouth. So if you haven't quite got that angle of support there, just sometimes the weight falls down and the breast falls out of the baby's mouth. So that's, underarm is a really good way to feed your baby, or sometimes lying down. And you might find that if you put your breast on a pillow lying down and put your baby on a pillow, and you use the opposite side, so you're lying on the side, and you're lying on your side on the bed, and your upper breast, because they're quite big, it's the opposite breast you're using. So we can't show you lying down. There is a bed here, but I think we probably wouldn't be able to show you on a camera.
No.
But you lie on your side, and your breast will fall into your baby's mouth like that. So you can have your baby on a pillow on the bed, so it's lifted up, and the opposite breast goes into the baby's mouth because your breast is quite big, and then you can usually see what you're doing. So if you're lying on your side, the baby's on a pillow while you're feeding, and then you use the opposite side, and sometimes that's easier than if you're lying on your side and your baby is feeding on your side, on the same side that you're lying on, because it might just be a bit too big and a bit overwhelming for your baby. So what else have we got to say about?
Well, I actually thought I'd just use this because who was the lovely midwife who made this? She's a midwife now. She wasn't.
Fiona.
It was Fiona Castle, wasn't it?
Yeah, Fiona.
So Fiona. She was at the time. She wasn't a midwife, and now she is. So we'll give her the credit for this because it's brilliant. Because when we talk about the angle of the dangle, and I've certainly been talking about it quite a bit in clinic today with parents, is thinking about where does your baby want to come on. So your baby wants to come on at the angle that your breast points at. So this baby wants to come on here. It does not want to be up here. So if you can imagine, if the baby came on up here, then there's going to be a big gap between its lower cheek and the breast, and we want that baby to come on so that it's nice and straight onto the breast. So if I bring it closer, this baby is going to come on like this, and the baby does not want to be up here. I often say to parents, what you don't want to see is the breast going down and the baby up. You want them to see them going together, depending on where the nipple is pointing. So this was here. So if this mother's breast, as we were saying, I'm going to fold it in half because it won't be so obvious. So if this mother's nipple was there, then actually the baby wants to be here. You need to think, where does the breast point? The baby needs to always come on at the same angle. So a mother with a smaller breast is going to have the baby up here, and the mother with a bigger breast is going to have the baby down there.
So that's a simplified picture of it. You know, it doesn't matter what size the breast is, the principles are always the same.
Yeah.
Whatever, wherever, however, whether it's underarm, sitting up, across your tummy, you know, across your body, whichever way, the principles are always the same when you're breastfeeding. You know, you've got to get that angle right so the baby comes on, and then that nipple is stabilised in your baby's mouth.
Should we use the pillows here and just show how you would put the baby in an underarm position, and what we would do? So we often use chairs in the clinic, so we can turn that on. So you could do it on a bed, and you would put pillows to support the baby, and then the mother brings the baby to the breast. But the baby wants to be a lot further back than I think mothers realise. They
almost
think
feet on the bra strap, isn't it?
Yes, absolutely. They want to be right back. They don't want to be sticking out forward here.
You see how far round I am?
So this baby is right back
Right
over
back
here.
there. So its feet are almost on the bra strap, and its baby's bottom is almost against the back of the sofa or the back of the chair. You know, its bottom is leaning, and their feet are at right angles, so they're tucked round the contours of your body. If you have your baby like that, you're not going to get your positioning right. If you see that, it's right sticking out there. You want it tucked right into the contours.
In and round.
Exactly the same as if you're doing across your body like that. It's exactly the same principles. And people often go wrong doing that because they stick their baby out and it leads with its nose, not its chin. So you need to be getting the chin leading, and the baby can lift its head back and take the breast into its mouth. But it is much harder to get used to feeding with very small or very large breasts. It's, you know, it's slightly...
Every breast has a challenge.
Yeah, every breast has a challenge, but it is more difficult for you to see, and I think you need to give yourself lots of tips to help that. So support your breast from underneath, put a sling around your neck, and, you know, maybe just have a little look at your breasts and see where they're lying, you know, to make sure that you can see what you need to be doing. And make sure that your baby can breathe okay and you can see what your baby's doing, because I think a lot of people with very large breasts worry about their babies being able to breathe because they can't see what's happening if they're very big. They're just normal. They're normal, and babies don't know any different. And you know, milk volumes aren't the same in everyone. So it doesn't mean that you've got big breasts, you've got more milk, little breasts, you've got less milk. It's what you get is what you get. And
that's just a bit more storage capacity with the bigger breasts, so it might go a bit longer. Whereas the mothers will produce the same amount of milk depending on, you know, regardless of the breast they have, but some babies might be able to go longer because the mother can actually produce more milk in one go. Whereas a baby that has a mother who has a slightly smaller capacity, that baby might feed a little bit more frequently. That's the only difference, really, isn't it?
Yeah. So
I think we're being offered tea.
We're on live. Facebook Live.
Were we being offered tea?
No. Somebody else was looking for us.
No. So we were talking about that. So thinking about if you're in the underarm position, which Naomi's demonstrating, is to ensure that you've got nothing behind the baby's feet, so that the baby can't push off. So they can't, because what happens is their natural reaction is if there's something here is to push.
So move back up.
So if
like
you're
this.
doing it on a sofa, if you can take your back cushions out, and line them all up in line with your back, so that the baby then goes alongside it and has got double the depth to sit in. Because if the baby's then got its legs crunched up to be here, the first thing they're going to do is push and come off. And that positioning attachment that you've worked so hard to get right is going to be for nothing. So thinking about making sure you've got enough to keep the baby at the right height so you're not all twisted over, and that you're far enough forward with stuff behind you that you've got the space to for the baby to go behind you.
If you've got squishy arms on your chair, then that might help support like a pillow, but if you've got rigid arms, you might find that really difficult.
Yeah, absolutely. So it's been very quiet. We've had no questions at all. So quite a few people watching, but no questions. So by all means, start firing questions at us.
So whether they're not coming in, but I haven't seen anything come through. But
no, I've got them up here. So,
yeah, just keep trying, and you know, always make sure that you get lots of support if you're worried. You know, make sure you access the local services. So your midwife is your first port of call, always. So when you go home from hospital, or when you're on the ward, the carers on the ward are the people that are looking after you. And then when you go home, then your community midwife is the normal. And so if you haven't got any particular problems, you're just a bit sore, you need support with positioning and attachment, you can't attach your baby, maybe you can feed on one side but not the other, then you might find that you know, you just need a little bit extra. So when you're having your checks with your midwife, try and time your midwife check with a feed. So if you're coming into one of the units, say Wantage, Wallingford, Chippy, Banbury, or up to the Spires, you know, or one of the children's centres, then you know, as you're going in, just make sure you sort of time it with a feed. If you think, yeah, I've got a few problems, my midwife, I would really like a bit of help from the midwife, then time it with that so that you can get the support at the same time, and then you know, you can get further on, you can get, you know, a bit less stressed by it all, because it is very stressful having a baby that won't attach. And we have many babies that don't attach when they're newly born in the hospital, and they go home and they haven't had a breastfeed because they're just very sleepy, or you know, sometimes mums and babies don't have the skills. Sometimes babies know what to do, that makes it easier. Sometimes mums know and babies know, and it's just sometimes it works, sometimes it doesn't, and some people are more coordinated than others, and it just takes time. So I think you've just got to keep working with it while you're protecting your supply, and don't be demoralised if your baby doesn't suckle. It's always better if they've had a suckle at birth, and that's why we talk about the early breastfeed in the first hour or two, to get that priming, so that they know, and they've got that memory of breastfeeding. They will go back to it. It's much easier to get babies to breastfeed if they go back to it. So keep persevering, lots and lots of skin to skin always, and you know, work with what you've got. Don't think that there's something wrong with your anatomy. I think that's the important thing. So
I've just refreshed, and they haven't come up on there, but they're coming up on here now. So sorry folks, because we couldn't see them. I can see there were 4 comments in the end.
So you know, just keep going, work with your attachment, protect your supply, lots of skin to skin. Do lots and lots of hand expressing, and give your baby frequent small amounts of colostrum, and we've talked about this a lot with tummy sizes.
It's usually me, I have to hold the
My sister.
It's my job.
We've lost one.
No.
Could be in the bottom somewhere, I should think.
So first stomach
so that's
size.
Your baby's first stomach size.
Think of a cherry. In fact, this is quite a small cherry actually, but think of a cherry. And the thing about it is, I was talking to some parents the other day, and they've seen some volumes about it and what this might mean. And I said, but if you're thinking volumes, you're thinking Christmas lunch every time if you're filling that tummy. So, you know, we don't want to fill our tummies every meal. It's once fine, you know, Christmas lunch is fine, but you wouldn't want to have that meal every meal. You really wouldn't feel comfortable. So when you're expressing in those first days, 0.1, 0.2, you know, in the first few feeds in that first day are absolutely fine if your baby has no risk factors. So we're not worried about babies from underfeeding in the first of 24 hours or so. Just because colostrum is a food in concentrate, and babies don't have a huge need for food. Have you got the other ones?
I've got lots of things going on here. Oh yes, here they are.
Okay.
And we talk about our syringes. So these are the 1 ml syringes that you use in the early days, and when you do antenatal colostrum harvesting or collecting antenatal colostrum. And 0.1 is the first notch on that. That's 1 ml, and 0.1 is what we'd expect you to give your baby in the first day or so.
A number of times.
So you give lots and lots and lots of 0.1 of a ml, 0.2 of a ml of food, and you just keep giving it. So every hour, every couple of hours, do a bit of hand expressing, because that will really get your stimulations going, and then your baby will get calories at the same time.
So you can see from the picture that we go from that cherry to the walnut very quickly, because that's day 0 to day 3, and that's what we're talking about here.
That's day 3 there.
So we're still talking very, very small, but the volumes are increasing, and that goes in line with your milk supply. So as long as you're asking for your milk, the volumes will go up. Should we have a look and see what we've been sent?
Yeah.
So Virginia has said, "Hi ladies, I've been watching you since the end of my pregnancy and your advice really helped me, especially in the early days. If not for the knowledge that I got watching these videos, our breastfeeding start would have been much different, so thank you. I was hoping you could help me understand what's happening. My baby's 6 weeks now, starts kicking and throwing his arms around, squishes his face into my breast and then pulls away because he can't breathe. Sometimes pulling the nipple at the same time. Then he grunts and shakes his head as he tries to reattach again. Is it the milk flow, reflux or something else? Most of the time this fussiness happens in the evening." That might be
That's
the clue.
really frustrating,
the
isn't it? And these evening feeds, they're very chatty, aren't they? And it tends to get better as they get a bit older, up to about 12 weeks. So, you know, you're halfway there really with these babies learning to adapt to being outside and, you know, having milk feeds. But I think that you need to look at your attachment, perhaps that you're not quite there, and the shaking of the head or, you know, the fussing of the breast means that they're maybe not quite right. And I always say it's like putting your hand on a door handle. If you put it next to it, the door doesn't open. So you've got to put your baby on the handle every time to open the door. So you've got to get that positioning absolutely brilliant in order to get your baby to milk the breast properly. And if they're getting a little bit bigger, and you always say this, don't you, that you have to move them further round because they're bigger. So you've got to move your baby to keep that positioning right.
We've got a small doll with us today.
No, I haven't.
No, we
actually.
haven't. Okay. So if you imagine having a small baby, let's squish this one up. You would have your baby here. Well, when the baby gets bigger, we don't keep it there. We actually have to keep it moving round. So the baby will start nose to nipple here, and then mums tend to have tendency to then put their bigger baby straight across as well. But actually, that baby needs to come further over. And it's always remembering that you need to start nose opposite nipple. And I know we go on and on about it, but that's your starting point. So the baby ends up following your body round and ends up cuddling you round.
So you keep your baby in the contours, and you just make sure you line their nose up to the nipple and the chin is really underneath the breast, and you know they become much better at it, and you become a bit more relaxed about feeding once you've got to 6 weeks because you've got used to doing it 8 times a day minimum. You know, everything's sort of falling into place, but it's as easy to get into bad habits doing that as it is to get into good habits. And when you're tired, you bung them on, and that undoes a lot of things that you've been working on all day. A lot of people go back to default at night and end up doing what they were doing when they have had problems. So as Alex said, you know, line your baby up. It might be that you need to revisit your positioning. It might be that you need to talk to you know, your health visitor to come and watch you feed, or Oxfordshire Breastfeeding Support may be able to do a Zoom with you to support you, just to see if there's any tips that they can use. But I think follow those tips where you just need to adapt your baby to your body again to make sure that you get your baby on the handle to open the door, because that makes a huge difference in their behaviour. It could be that they're snacking quite a lot in the evenings and getting a bit too much lactose, and you might find that if they're not quite on deep enough, that they're getting milk in their mouth rather than going down their throat, so they get quite a lot of pooling in their mouth of milk, and they splutter and cough, and they find it as a not as pleasant experience if they're having to sort of splutter with a feed than if they have a nice smooth feed and it all goes well. So it could be something as simple as that you just need to revisit your positioning and attachment. There's always room for improvement in breastfeeding.
There is.
Always. So, you know, just because you've been doing it okay, you can tweak it and make it better again. And that might be all you need to do, move it a few millimetres just to make it better.
And the other thing to say, obviously evenings are the time when most of us feel like we have the least amount of milk. And whilst we may not have big quantities, what we do have is high fat milk. So mothers in the evenings will have much higher fat milk than they do in the day. So when you wake first thing in the morning and you feel really full, which many mothers do, they find they have more milk. Why, I don't know, because we're still feeding through the night, but never mind. But you know, they often feel much fuller in the mornings. Then actually the fat proportion of that milk is lower. When a mother feels less full, then the fat proportion of that milk is higher. It's the biggest change going on.
It's usually about 18% more fat.
It's the biggest change that you see in maternal milk is the fat content, and it's in relation to the fullness of the breast. So the less full the breast is, the higher the fat content. So it might be that your baby's looking for slightly more volume, but actually what they're getting is high fat. So making sure they can access that high fat milk, and that's where positioning attachment, really good positioning attachment, is important. May make those feeds a little bit easier as well. So thinking about that. But So I hope that works for you. And I access help, Virginia, if you need it. But do think about how you're bringing your baby on. Can you amend your positioning and attachment a bit? I'm going to go on to Rachel. Rachel said she's been colostrum harvesting and advised to continue this, as hoping for a vaginal breech birth. Sometimes the colostrum becomes very watery rather than thick and yellow. Is there a limit as to how much should be harvested? I'm aiming for 3 times a day at the moment, and a good session gets 10 mils in 5 to 10 minutes. Oh my word, Rachel! I think you're going to be donating. She'll be hard pushed to get through that much. That's fantastic. I mean, most mums are pleased.
Got a great skill.
Yeah, most mums are pleased if they just get a tiny bit in a day, but 10 mils in 5 to 10 minutes.
Session, yeah,
that's fantastic.
A day, your baby's going to be very lucky.
Yeah. I mean, if you've got lots already, then there's no huge need for you to carry on. You've got the skill. You know, if you've already got a ton in your freezer, then you probably don't need to do any more. The only reason you might want to do more is if you felt inclined to donate it, which, because I have a feeling that you probably won't need to use this much. Because remember that your milk supply is driven by milk removal after the baby is born. So much as it's lovely to have this buffer of colostrum, if you go and feed your baby this colostrum when your baby is born and you don't put your baby to the breast and you maybe don't express if your baby's struggling, then actually you're not actually working on the supply. So what's going to happen is that you won't, having had this fantastic amount of colostrum, you won't have a milk supply, because the only impact that you have on your supply is after the baby is born. So much as you've got this, you can't rest on your laurels once the baby's born and give colostrum and not breastfeed, or give EBM and not breastfeed, so not hand express. So from that point of view, you would need to keep going. So you might be able to actually take your foot off the pedal and have a break, but you've got the skill, which is wonderful. Alternatively, if you want to carry on, I'm sure Amanda would be delighted to have some colostrum for her milk bank if you don't get through it, which is quite likely.
Really little tiny babies and big babies colostrum in the first few days.
Because we don't get much colostrum for the milk bank. It's usually mature milk, because most women do not have more than they need, which is, I think you do from the sounds of it. So Rachel, that's fantastic.
You didn't say how far on you are, so
no.
Good luck with your delivery.
Yeah. No, Rachel's put our questions not coming through. No, they weren't at the time, but I've refreshed and it did. I'll refresh again in a minute as well. Samantha said, hi guys, Elizabeth is 4 months old now and still going strong. So thank you very much for earlier advice. Just wondering if you could advise on safe hay fever medication.
Do you know, I was going to talk about that today, just thinking about it. So
I would say,
us to it.
Well, go and have a look at the Breastfeeding Network. Dr. Wendy Jones has done a whole paper on that, an information sheet. She's absolutely amazing, Dr. Wendy Jones. She's a pharmacist with a specific tendency towards lactation. Her speciality is lactation. So she is definitely the place to go. So if you do a search for Breastfeeding Network, and then you'll see that there are drugs in breast milk fact sheets, and it's got all about them in there. I mean, the one thing that we would say to you is please don't ever take Sudafed. It's worth going and looking at those the hay fever advice, because actually you can take hay fever medications, but the one thing you do not want to be taking is Sudafed, which is the medication that dries you up, because actually it dries your milk up too. So that's the one you want to avoid. But yeah, what were you going to add much more to that?
No, I was just, because people are very happy to take it with all the hay fever around and everything else, and or if you get insect bites and things like that. But you do have to be a little bit careful. Check with the pharmacist if you're breastfeeding that it hasn't got something that dries up the secretions. Because if it dries up your mucous membranes, it will impact a little bit of your milk supply as well, and that will be very sad if you've worked really hard to make a supply and then you take something and it reduces your milk supply again.
Yes, I think I would highly recommend anybody who's got any concerns about medications to have a look at the Breastfeeding Network, and she's got sections on antihistamines, on analgesics, anaesthetics. I mean, just literally everything, isn't it? She covers it. She covers it. Yeah, she covers the lot. And if the answers aren't there, then you're very welcome to get in touch with us, because we have access to online resources as well, which we can look up and
actually
check
there
for
are
you.
very few drugs that you can't take with breastfeeding. Things like chemotherapy and some antipsychotic drugs. So if you've got depression or things like that, you can struggle to find drugs that you can have that are compatible. But mostly, anaesthetics and all of those things, they're fine. Most of them are right, and pain relief is normally okay. Codeine, I think, is one that we don't recommend that you take. And if you have to take it, you take the smallest dose for the least time possible if you're taking something like codeine.
So we've swapped to dihydrocodeine, which is thought to be a bit better, but the problem with codeine or any of those derivatives is that we don't quite know how you'll break it down as a mother, and that's because we don't know how you break it down. For some it will be absolutely fine, for others it will not be fine. Because
sometimes it's stored in the liver.
Yeah, and it can make babies drowsy.
Yeah.
And obviously if a baby's drowsy, they're not going to feed very much, so there are issues with it, which is why if you're here and if you did have a section or an instrumental birth and you're given dihydrocodeine, it will always be for the shortest period of time possible, and that would be the medication you would drop first. So you go dihydrocodeine drops, keep going with ibuprofen if you can take it, and paracetamol, and you just then sort of slowly work your way down till you don't need anything else. But any codeine type medications would be for the shortest time possible on the lowest dose possible.
Yeah.
Hannah has asked, how long can you still receive support after discharge from the community midwives?
Well, normally community midwives will see you for about 2 weeks. But if you've got problems, they may see you for a little bit longer. But your health visitor takes over your care normally at about 14 days, and you should have a contact with your health visitor between about 10 and 14 days. If you need infant feeding support, then if it's more specialised, then you can contact us and have a conversation with us, and you can just ring us up. You don't need to be invited to call. Your midwife doesn't have to introduce you to us. You can just call us, or you can email us. And also your health visitor can continue giving you breastfeeding support in your local area, which is far better than having to come into a hospital to see people. So use your local support first, and then work outwards. Things like the Abingdon Baby Cafe. I'm not sure if Sue's doing face-to-face contact.
Not last I heard.
I think they're all doing online stuff, so they're doing Zoom or telephone consultations.
But they've done a brilliant job. They've made it really work. They don't feel that it's not good support. It is extremely good support that you'll get.
And they're all lactation consultants, so they will give you absolutely amazing advice and experience. Very, 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 very experienced. And the Oxfordshire breastfeeding support, obviously, as well, is local to Oxford. So there are places that you can contact. Their Lecce League as well.
Yeah.
But your midwife or your health visitor are the first two people that you would go to. And I think if you've been discharged and everything's fine, but then a couple of days later you're struggling, then your midwife will probably be happy to see you again. But if it's 2 or 3 weeks later and your baby's 3 or 4 weeks old, then we wouldn't expect you to have access to your community midwife at that point. It's not normal for them to continue your care beyond being discharged. Partly because your health visitor is your primary care in the community at that point with your GP, and so they would be the one that would give continuity of care to you if you needed extra support.
Yeah.
And that answers your question.
And we carry on seeing people up to about 6 weeks. So that's our limit. It's within maternity there are certain limits that then it gets carried on. So whilst thumbs up for this one, right answer then. Whilst your midwives are up to the 2 weeks or so, they can actually, if your baby's struggling to gain weight, then you may be kept on, or there are other problems, you may be kept on up to 28 days.
Yeah.
That's the limit within midwifery. That's the statutes written, that we as midwives have care of the mother and baby for 28 days, and thereafter it does automatically go to the health visitor. We've been given permissions and dispensation to carry on for up to 6 weeks as a team, so we get a little bit longer, because breastfeeding problems don't always resolve straight off, and so we try and get people going as best we can in those first 6 weeks.
So if you are with your health visitor, your midwife, we would expect your baby to have gained its birth weight by about the maximum 21 days. We'd expect your baby to have gained its birth weight by about 10 to 15 days, but some babies take a little bit longer, but we would expect them to have gained their birth weight by 21 days. So, if they haven't by about 10 to 15 days and your baby is a little bit off its birth weight, we would probably be involved at that point, if not before. in order to put plans in place and to continue the care if we need to. But most babies do gain that weight. Just occasionally we have babies that aren't, and then your midwife might be continuing to see you in the community because we only do limited clinics with a couple of days a week, so that you've got to have your care a little bit more frequently than that. Your midwife may keep you on and look after you for a bit longer, just to see what's happening. And we work together alongside each other.
Dovetail. So that was Hannah's. So, and then another Hannah, different Hannah, has said, I had to express and bottle feed my 4-week-old son for the last 2 weeks due to thrush. He's now reluctant to go back to the breast. Can you give me advice on how to encourage him back on, or any tips? Thank you. Oh, that's been a bit rubbish then.
Hopefully your thrush has sorted itself out and you're feeling a bit better now.
Yeah.
I mean, I always talk about giving your baby a present, reward them, and if they go to the breast and they don't get an instant hit, they don't know what to do. They do forget, that they have to suckle a little bit more before they get the flow. So you could get your flow going before you put him on so that he gets a very good instant hit. So you might find something like a hacker or a tiny little bit of pumping will get the flow going so that he gets a mouthful as soon as he feeds. The other thing you can do is, with a bottle and a teat, I don't know if I've got one, or a syringe, you can just pour milk all over your breast while he's there, so he's licking and getting milk when he's at the breast all the time. And that will remind him that that's where the milk's coming from, and he will probably go back on. Have you got a really good supply? If you've got plenty of milk, then he probably will go back happily if you do that. If you've got a low supply, he will get frustrated because of the flow. And babies are flow confused. When they get lots of bottles, they get much faster flow for the whole feed, and they get very quick, instant hit of milk when they first suckle on a bottle. So they expect that when they go to the breast and don't get it, so they stop before the milk arrives. So that's where your little present all the time, dripping breast milk all over your breast. You make a mess, you need a muslin around you or a towel so that you can collect all the drips that you're making, but just pour milk everywhere. And they normally go back because they're happy, and as long as they're getting milk to lap, they are happy. And work on your supply if it's low, so that you've protected your milk supply when you haven't been feeding, so that the supply is still there. It's really important that they get a present, and if they don't, they just think, well, what's in it for me, and they stop.
I think it's trying to keep it all positive as well. So offering your baby a feed at the breast when they're not desperately hungry, so that they're just quite happy to just chill at the breast. So then they remember, oh yeah, that's where the milk comes from. So just giving your baby those times skin to skin will make a big difference as well. I know we talk about skin to skin in the first hour after birth, but actually skin to skin has a part to play throughout a breastfeeding journey, and is really, really good for resetting breastfeeding problems. So from that point of view, well worth trying, back to skin to skin. You could be doing skin to skin and what Naomi's just mentioned, dropping the milk, and that's giving the baby the reward. But what you don't want is a baby that's upset. So the minute your baby is upset, stop and do something else. Because we don't want that baby to associate being at the breast with something it's not working for that baby.
You can try when it's really sleepy. So before your baby's woken up, it's almost like a dream feed. Put your baby to the breast with a bit of reward, and he may bypass his conscious mind and just suckle, which is the baby's reflexes, and will probably go back to the breast and suckle without realising. So just before they're waking up, pick them up and see if they'll suckle without too much effort, and they often will bypass their mind and just suckle at the breast. So lots of rewards still, so that there's milk everywhere, and they may just do it in their unconscious mind, and then they're away again and they remember what to do. I think the least thing to do is using a nipple shield. It's probably the last thing you would do, but it is something that you could look at if your baby's really dependent on plastic. That's their driver. So if you put the nipple shield near your breast, or put a teat near their mouth when they're feeding, and then move it away, and as they're gaping, and put your baby on the breast, you can try that rather than using it to feed. And then, or you can put the shield on and then take it away once the flow is there, and put them straight back on the breast, so that they just use it to get the milk flow, because that's the plastic that they're looking for. That's what their driver is. and then take it off and put your baby back on the breast. And you might find that encourages them to go back, but you know, that's last resort really. You want to try all the normal things first before you introduce anything.
Do all the other
it's
things
last
first.
resort, and it's not, you know, they do get very addicted to them once you start using them, and then that causes its own problems. And they do get less milk through them. So, you know, if you've got low supply and you use a nipple shield, your baby is not going to get as much milk. And so the risk is that they won't be gaining as much weight. So that creates other problems other than the dependence on them, and they won't shed them until they're ready. So you end up with nipple shields for months and months if you're not careful. So it is a last resort, but occasionally you can do that just to make them recognise that that's an okay place to be. Are you feeding your baby a bottle when you've been giving it very close to you? So have you been holding your baby really close to you like that when you've been giving bottles while you're treating your thrush? Because then if you're feeding your baby away from you, they've got used to being away from your body. So if you're feeding, you know, go back to feeding really close, and also to swap sides when you're giving bottles so that they get used to going to both sides of your breast as well, so that they get used to being close to you again in that breastfeeding way. And you could just give your baby a little bit of food and satiate them a little bit, and then go to the breast once they're not quite so hungry, and they may then go back to feeding. So you don't have to start with the feed. And the other thing is a little tip that you squeeze the teat. We've got a teat here. Squeeze the teat when your baby first goes on the breast if you're offering the bottle, and it stops the flow for a few suckles, so that they don't get milk immediately. They have to suckle several times to get milk, and then you release it so that they get milk later. And then that sort of is more like a breastfeed, so that when they suckle they don't get an instant hit, and then they often will go back to the breast more happily. But that might not work for you at this point, because you know, you've been giving bottles for a few days. So, but that's something that might help if you are using bottles as well, is just squish the teat at the top before your baby gets milk, and then release it once they've had 3 or 4 suckles, so that they don't get that hit straight away. And that might help with you know, introducing back to the breast.
Good luck, Hannah. Hope it goes well.
It's hard. It's really hard.
Virginia said it's quite difficult to manage the latch on as he shakes his head side to side coming on. Says Virginia, who messaged earlier.
They quite often do that if they're not quite in the right place. They're saying, "Move me, I'm not in the right place." You know, it's often them telling you to move them so that they can be in the right place. It might be worth contacting someone to watch you feed if you're struggling.
I think
How was your baby 6 weeks? So
I can't remember now. Let me have a look.
you could see if there's a possibility with OBS to see if they can do a Zoom with you to see what's happening.
Yeah.
Your health visitor team may well be able to put you in touch with the infant feeding support there if you're still struggling. Most babies make that sort of movement when they're not quite in the right place, and they're saying, "Move me, I'm not quite in the right place to feed." So it might be that you just need to reposition your baby at the breast again.
Right, so we've done that one. So good luck with that one as well. Rachel said she's got the stuff from the milk bank for donation. That's brilliant, because I think, you know, it is very rare that we have mothers who produce the sort of volumes of colostrum that you're producing, and if you are in a position to donate it, it would be well used, I can assure you. So that's great news. Samantha has come on and said thank you. I'm trying to remember what we said to Samantha now. Oh, 4-month-old and the medication. That's right. Brilliant. So we pointed you in the right direction, Samantha. Jessica said, I'm wanting to introduce bottled express milk to my daughter, but she's refusing to feed from the bottle. Do you have any advice? Some of what you've just been saying.
We talk about this a lot, don't we? Yes,
Yeah.
Some of the things I've said, absolutely, you know.
Trying somebody else other than you. You may have done that already, a partner.
How old is your baby?
We don't know. She might come through.
Does she need a bottle? Is she too young not to have a bottle? If she's a little bit older,
she could go straight on a cup.
Yeah, you don't always have to give a bottle. I think that's a myth, really. If they're very little, you might have to, but you know, cup feeding is okay, even for little tiny babies. And yes, just sort of get someone else to do it, and see if they'll do it, and try some different things. So try different cups, different times of the day. You know, let her play with one.
Yeah.
You know, let her just have it, and if she's big enough to hold it and to use it herself, so that she, you know, is exploring with it. Depends how old your baby is, of course. And yes, get your partner to do it if possible, and don't do it when they're really, really hungry, so that, you know, it's a battle then.
I think remember that babies take time to learn how to feed from a bottle. They're born expecting to be breastfed. There's a very different mechanism to feed from a bottle from a breast. So they have to learn a new way of feeding. So give your baby time. And as Naomi said, don't try when your baby's desperately hungry. Try other times. Try between feeds. Try after a bit of a breastfeed. All those sort of times, and see how you get on. You know, try when your baby's just waking up, like we mentioned earlier, because that would definitely, that's definitely a good time to try. You know, sort of like a dream feed, where they're sort of, it's not quite what they're expecting, but they're quite amenable. But yeah, lots of different things you can try in that respect. But try to take sort of the pressure off it, really, because it can become a bit of a battleground.
And you don't want to develop aversion to feeding, which will happen if you're trying to force it on a baby. You know, any feeding will become unpleasant, and they'll just go on strike. They won't breastfeed, they won't bottle feed, they won't do anything, and that's you know, the worst thing that you want to happen. So, you know, feeding should always be positive. It should always be reward, and you know, it should always be a positive oral experience, a pleasant experience. So, you know, that's how you have to keep it. So just a few minutes, try, and then leave it, and go back to it another time when they're distracted from something, or they're happy and you know, just talking to themselves, chatting away, and so they don't notice in the same way. But you might have fed, and they, you know, they're satiated, and you might find that helpful. But don't force it, because it will become a battle if you do that, and then it becomes a big problem, and that's really important. So you know, just keep going, but do it intermittently, unless you've got a date that you've got to do it for, you've got to go into hospital or something, or you've got to go away and leave your baby behind. You know, then you are under a time limit. But generally, just pace it and do it when and they usually do it when they're ready. They usually settle down and will accept it. But it's odd, isn't it? You spend all this time trying to get your baby attached to the breast, and then wish that they're breastfeeding and they weren't on bottles, and then suddenly you want to give them a bottle and they won't take one anymore. They use a different mechanism when they breastfeed to bottle feeding. So if you do swap between bottles and breasts, some babies don't care what goes in their mouth at all, and they will accept anything, and that's just how it is. And other babies, you know, you give one bottle to them and they'll never go back to the breast, and that's why we don't know which baby's going to do that, and sometimes they get really confused with it. But normally it's about the flow. It's not about the breast and the teat. It's about the flow, and that's the thing that triggers, you know, lots of problems with feeding with bottles. But you know, some babies just won't do it. They just don't want to do that, and they just love being at the breast and love breastfeeding, and it's all normal. But you know, it's the luck of the draw, really, as to whether a baby will take a bottle or not. Some are just very happy whatever you give them, and they don't care changing between the two, and then others just are absolutely horrified at the thought of it. But they do feed in a very different way at a bottle. So when you put a bottle in to start with, they will move it around their mouth and stick their tongue in all sorts of different places.
Can't work it out.
Clamp down on it and you know, stick their tongue out. They really don't know what it is in their mouth. It's very different feelings. So you know, and all bottle teats are bottle teats. They're not close to breast. So, you know, buying a special teat that's £20 is not going to be any different to a bottle that's, you know, that's a teat from a low-cost supermarket, something like that. They're all teats. So, you know, don't be fooled to thinking that if you buy an expensive one that says it's the closest to a breast, it's not. It is going to be a teat. They're all the same. So they may look slightly different shapes, but they're all teats, they're not breasts. So, you know, just try several different ones, but your baby will have a different way of feeding with them. So they just have to learn to adapt and use their mouth in a different way. And some babies get it and some babies don't initially.
So Gemma has said, carrying on from what Samantha was saying about, is there a safe medication? So I've nipped onto the Breastfeeding Network, that's what I've been doing if you've seen me looking down, to have a quick look. So I've just put in, the search I put in was Breastfeeding Network antihistamines, because that's what they are. and there's a whole section on it. It's a section called "Can breastfeeding mothers take antihistamines?" And it's talking about which ones there are around. So there's a whole section on it that you can have a quick look at, and it talks about non-drowsy and drowsy and the recommended, which ones that would be fine. So just checking to see if I can see. So for instance, Acrivestan, I probably can't say this name properly, Acrivestan, they're just saying observe for the baby to be a bit drowsy. So if you have a peek on that, that's your best bet. And it has sections on sedating and non-sedating, optimal choice. So so what she states is most of the drugs to treat allergies are available to buy over the counter, but the leaflets may say they're not suitable to take whilst you're breastfeeding. This does not necessarily mean that they're dangerous, merely that the drug company has not undertaken trials itself and has chosen not to recommend its use in this situation. And this is one of the problems that we have. They will always do a disclaimer. Yeah. So she also has a section on hay fever and breastfeeding. So that was the antihistamines. So you can go on through on the Breastfeeding Network to the hay fever one. And it's not wanting to load for me. Here it goes. So it talks about what symptoms are, and if you've got it, you know what it is. And then it goes into the different types of medications. So it's well worth having a look there for yourself at the Breastfeeding Network. And as I say, it is a really, really good resource. It's fantastic from that point of view in that it is, is research-based, evidence-based. It's absolutely fantastic from that point of view. So any issues with drugs, the first port of call will always be Breastfeeding Network, and then do a search for whatever it is you're looking for. So I hope that's answering that question for you. Have a peek, because they are on there. I mean, there are medications that are safe. They are considered safe for you and your baby. So, I mean, only a portion goes through, remember. So I hope that helps and reassures you, Gemma. Other Hannah again, so it's the one we had earlier. I have a good supply, so we'll try the present, Naomi's present for the baby, and other tips. Thank you so much.
Let us know how you get on, because it's good feedback for other mums that are listening as well, to see if it helps them.
And I think, as we've said before, we would like to know what you want us to talk about.
Yeah,
so,
always.
So,
gives us ideas, because we've done lots of these now. We're probably on about 60, aren't we?
Yeah.
And probably a bit more, actually. And, we keep saying the same thing, but obviously people aren't listening. Some people are listening every week, but Alicia's not here this week, is she? She's in Devon.
No, she's in Devon with her mum.
Nice week for being in Devon.
Yeah.
So we'll catch her next week. But, lots of you have been with us from the start and have supported us, and we love that. But, we love to have questions as well. Really complex, really silly, really, obvious ones, because we are, there's only a certain amount you can talk about with breastfeeding and positioning and things like that. So it's really nice if things are helpful to you, and we try and make it as interesting as we can each week. But do point us if you want to know about something. Just put it down and ask us, and we can go through it with you, because it's fresh eyes all the time. And that's why we ask women in clinic every week, because we just say, what would you like us to talk about?
That's why we talked about larger breasts.
Yeah.
So Jessica's come back. She's trying to get her baby to take the bottle, and her baby's 4 weeks. So I think
I think your baby will probably take a bottle at 4 weeks eventually.
Yeah.
It should probably do that.
Take the stress out of it though. Just try and make it nice as much as you can.
If you're having to go back to work, then that's really stressful for you. But if it's just because you want to give a baby a bottle in the evenings, it might be worth just leaving it for a bit and going back to it another time. We tend to say about 6 weeks to establish your breastfeeding, because it takes about that length of time to get your sort of supply sorted out and secure your supply really well before you start interrupting it with bottles. So obviously, if you're wanting to keep breastfeeding, when you're introducing bottles, you need to pump when you give that bottle, or around about that time, so you're protecting your supply. Otherwise your supply will drop down. Unless you do that every day, you're going to give the bottle at the same time every day, and that's what you're going to do. And also, the other important thing to say is, if you're dropping breastfeeds, your contraceptive effect of breastfeeding in the first 6 months will change, so you're not protected. The risk of you ovulating if you have more than 6 hours between one breastfeed and another, which we wouldn't recommend at all if you're just breastfeeding, unless your baby's much older. But if you're giving bottles in between a breastfeed and it's 6 hours or more between a breastfeed, then the risk of ovulation is going to go up more, and the risk of, you know, the non-contraceptive effect of breastfeeding. We don't use it so much in this country, but it is vital in other countries as a contraception when you're breastfeeding. But if you have more than 6 hours between a feed, or you introduce anything other than a breast to your baby in the first 6 months, so that's bottles or anything else, then
even a dummy,
the risk is that you will alter the hormone balance and risk getting pregnant in that 6 months. So you know, it is very important, if that's the way that you're using contraception, that it will affect it if you introduce bottles at any point when you're breastfeeding in the first 6 months.
Fiona's put a question through. Just put, hello, I exclusively breastfeed my 6-month-old baby. She started biting down whilst feeding. Is there anything I can do to discourage this or help protect myself? She started doing it nearly every time. I want to stick with it, but my breasts are starting to hurt a lot. I bet they are.
6 months, did you say?
6, yeah.
6 months, yeah, that's really ouch, isn't it?
Yeah.
And the thing is, you react to it, and then they think it's funny, because at 6 months they recognise things like that, and they know that they'll get a reaction. So you know, you either don't react at all when they do it, and then they get bored and do something else, or you could try, you know, maybe a toy around your neck or something that will distract them when they're feeding. So you introduce that just as they're coming to the end of the feed, and they can then come off and be distracted. Do something that will distract them, other than they're concentrating and knowing that at the end of the feed, if they do that, mummy will go eek, and it's funny. So don't respond, and try some distraction therapy. So you might find that, you know, a little soft toy or favourite toy or something at that time, or introduce something new that rattles a noise that will stop them from thinking about what they were doing before.
And at 6 months, you're getting to the point where teeth are likely to be coming through too. So having teething rings or something nice and cool for the baby's mouth as well may help. That's what they bite on rather than you. But it is usually a phase. It does usually pass. So, you know, try and see if you can get through it. And that was Naomi's suggestion as well, because it would be a shame to have to stop at this stage because of it, because you've done an amazing job. And now you can start thinking about offering other foods. So this is where you start introducing complementary foods, whether you choose to go the baby-led weaning way or the more pureed way, whichever you choose to do. But at 6 months, your baby's gut has got enough maturity to break down the foods that you'll be giving them, and prior to 6 months that isn't the case. I was talking to a mum on the phone yesterday, and she was talking about when she was going to introduce complementary foods, and was questioning me as to why this is that we wait to 6 months, whereas we didn't in the past. And it is the maturity of the gut. You can give babies food earlier, but actually all you do is displace milk, and the milk is what's making them grow. So actually you are not helping them by giving them other foods before they're 6 months and have then got the maturity and the enzymes, etc.
Yeah, they've got amylase at 6 months, 5 to 6 months. They start getting amylase, which digests food, which they haven't got before that. So both Alex and I have got much older children, and we gave our babies, my first one was weaned at 3 months because that's what we were told to do 30 years ago. And I'm horrified by that now, and it was 4 months, wasn't it, for our second one. So, you know, we gave them food far too early.
Well, they couldn't cope with it, for apart from the fact that they actually didn't get any benefit from the food they were getting, they actually can't physically cope with it, because you spend more time putting it back in.
It's in and out, in and out,
because
in and
they haven't learned to take something from the front of their mouth to the back of their mouth, because they haven't got the development. So, you know, it's interesting, because, you know, if you look at natural weaning age, also if you look at natural weaning and you look at other animals, you know, we have been trying way too early up till now. And you now look at babies. So you know, now the readiness to be ready for complementary foods, you know, it can be that the baby's looking and reaching for foods. It
should be able to sit up and help themselves,
and can hold the foods, because obviously foods, so they can actually hold it and manage to get it to their mouths. It's a messy business, but it's quite fun. So sorry, that was a bit of
the house proud.
That was a bit of an aside. We just put plastic down. That's what I always did. That doesn't help you, Fiona, because obviously you're dealing with the biting at the moment, and that is really
But do something
hard.
to distract them. Get a toy that they love, or introduce a new toy.
Yeah.
So you break the phase, because if they get distracted a few times with it, then they will have forgotten what they were doing, and they'll move on to something else that will annoy you. So
Fiona's come back to say she's got no teeth yet. Yeah, but it's going to
but gums
come.
are
Oh
sharp.
no, I know it still hurts. They're really
Gums are
hard.
sharp. They are really tough.
really hard. I'm not
We
underestimating
get
that it
bitten in
hurts.
clinic a lot by little babies when we're doing oral assessments, and they bite down on our fingers,
Yeah.
and we go, ow.
No, and on the breast, I mean, that's not funny at all. So I'm not underestimating that it's painful for you, Fiona, but I'm just saying this is quite a phase, and it does happen. And better now while she's got those gums. So, right, I hope we've given you some suggestions there to keep going. Rebecca has come on and said her little one has reached 12 weeks, breastfeeding well. Noticed that letdown sensation has gone away in the past week. Still the same number of nappies each day, and baby gaining weight well. Is it normal to no longer feel the letdown when feeding?
Yeah, I think
And some people never feel them.
Most people don't feel a letdown. When you talk
Yeah.
to mums about, do you know what the letdown feels like, they say no.
Yeah.
The only sign they get of it is the suckling. So watch your baby suckling, and do they start, when they start feeding, is it that flutter, and then they go into that deep glub swallow? And when they start doing that, that means the baby's getting milk. And if your baby's pooing and peeing, it's probably doing, getting enough milk. So it's looking at that suckling and swallowing to see the signs of the letdown that you're not feeling anymore. But yes, it does change, and you go a little bit further down the line, you'll find that your breasts go back to your pre-pregnant state, even though you're lactating and you wear normal bras again. Your feeding bras aren't always fitting you as well, because your breasts change shape again, even though you're lactating very successfully. It becomes an autocrine rather than an endocrine, and so the milk is not in your breasts until you feed. So they're not as full, and people worry about that as well. So, and I think also your baby is having a very big growth spurt at 12 weeks, so you might find that the feeding has stepped up a little bit this week, and they've woken up more at night and are feeding more at night. That often happens at around 11, 12, 13 weeks as well, and they do that for about a week or two, and then they settle down again. And they're altering the composition of your breast milk for their next phase. So you might find that there's a few things have changed in the last few days that have made you concerned, or thought, oh, that's not the same, but they will settle back down, and you may not feel a letdown.
Charlotte's come on. She's obviously
listening to us in Cornwall,
from
or
Devon.
Yes.
She says, hi ladies, hope you're okay. Me and Alicia are down in Devon enjoying our time with my mum, and we've been on the beach. We have actually said hello to you already, Charlotte. We mentioned you earlier, you and Alicia. Hope you're having a lovely time, and I bet your mum's delighted to have you there. I'm just going to refresh again, because it doesn't seem to be loading unless I refresh, which is why I've spent the whole of this session looking at my computer.
Sometimes it does it, doesn't it?
No, another one's come up. Paulina has said, hello, she's the student midwife, which she's been on before. What advice would you give to a first-time breastfeeding mum on day 5 who's absolutely shattered and in tears because the baby is cluster feeding all night and can't be put down? How do you balance your advice regarding her mental health? And allowing her to take a break with a bottle while still gently encouraging to continue and protect her milk supply.
I think sleep round the clock.
Yeah,
that's the first thing.
Yeah,
make sure that she has little and often, and is she at home or in hospital at this stage? If she's at home, can her partner take the baby for a walk?
So she
go
can get
around
some
the block,
sleep.
and she can have an hour of sleep where she can't hear the baby and doesn't have to think about her baby, because that will mean that she's not sleeping with one eye open, which does not give good rest. Make sure she takes her clothes off and gets into bed properly and shuts the curtains and turns her phone off, so that there's no disturbance. If the baby is cluster feeding, then look at the supply. Does she need to do some pumping just to kickstart her supply a little bit? Is she a bit late getting her milk in? Because the baby may be chasing it, so you haven't said whether the baby's reached its normal milestones on day 5 or not.
Because presumably that baby's been weighed, so is the weight gain or with the weight loss within normal limits? Is it 10% or less? And what are the poos doing? So are those poos yellow now? Because they should be yellow. You should be having at least two stools every day, yellow stools, as of yesterday, as in the day 4, and that baby should be having at least 5 heavy wet nappies today. with no urates. So if that, addressing all of those and making sure the baby's getting enough food will allow that mother to get sleep.
Be reassured.
The issue with introducing a bottle at this stage just goes back to what we talked about earlier, and sometimes we do have to, is that baby then has to learn something different. So ideally, if the mother needs to be giving additional milk, could we think about a cup? Could we get the baby to drink it from a spoon before we go straight into a bottle? Remember, there are always alternatives to a bottle. The bottle, bottles are handy, they're very, very useful, but they shouldn't always be the first thing that we look at when we're looking at giving a baby additional food. And just make sure that positioning attachment is right, because if that baby's unwell and she's got the milk, then the baby will get the milk. And unfortunately, it is very normal for babies to be awake at night and sleep in the day. So back to what Naomi said, and get someone to give her some support so she gets some sleep in the day, and that she can get support through the night as well.
I think also normalise breastfeeding.
Yeah.
This is what happens, and that your baby will be feeding a lot, and that it's normal for your baby to need to be fed round the clock, and the expectation of the exhaustion, because we know lots of mums are struggling with their mental health because of the extreme tiredness and the anxieties of life generally at the moment, and absence of family support, and the big change, the things that there isn't access to toddler groups, there isn't access to meeting up with friends in the same way at the moment, and that is creating a lot of mental health problems for lots of mums listening today and out there. We know that, but I just think to normalise it all, to say this is what you should be doing at this stage, that you shouldn't be having long periods of sleep with your baby, and that you sleep round the clock. You shouldn't do night duty and day duty all day every day, because you will just go mad. I mean, sleep deprivation is a really big problem if you don't learn to manage it quickly. And are there medications, or is there anything other than risk factors where why she might not have enough milk at this stage? There's something else you need to look at.
I love it in Holland. I lived in Holland when I had my third child, and it was standard practice to put a note on the door that said mother and baby are resting. So it meant that people did not turn up, they did not knock on the door, they did not want to visit, and that would be a standard practice. It was a protected time for sleep. So mothers and babies were left alone for that period of time, and that's what partners can be really good at, is protecting time when mothers can actually sleep. So it is important, and it is an age-old problem that new mothers struggle because they can't sleep at night because the baby is awake, but then you need to try and support her to accept and to make the most of sleeping during the day and getting some sleep then. And it's amazing what just 2 hours uninterrupted sleep will do for a mother. She will feel that very many mothers will feel like a new woman even after 2 hours, when she's been used to having 6, 7 or 8 hours as a norm. Many moms will find in those early days 2 hours that allows her to reset and carry on.
And it is a big wave. One day you feel great, and the next day you're so tired you don't know where to go. You're so exhausted and feel so low, and then the next day you're back up there again, and it's just a roller coaster of emotions in the early days of having a baby. And it's having that support and knowing what to expect. We know that if you introduce bottles, and you don't want to introduce bottles, but if you have to, you have to. But if you introduce bottle because you want to have a bit more sleep, it's the main cause of reducing milk supply, and also for minimising the success of your breastfeeding. We know that impacts your long-term breastfeeding success. So if you normalise breastfeeding, and this is what your babies do every day, every night, in the first 2 weeks, and it changes every day in the first 2 weeks. So somebody might say on day 4 this is what your baby will do, and on day 5 it'll do something else, and on day 10 it'll be doing something else. That is what happens, that every day something different happens to your baby at this stage, because they're just adapting to being outside and getting milk and starting to poo and recognising that it's feeding time, and they're waking up. A 5-day-old baby and a 15-day-old baby is very, very different. And you'll say, as mums, you'll see that, your baby's very jaundiced, very sleepy, they hardly open their eyes, and then a day 15 baby is really alert and looking around and asking for food in a different way. So, you know, there's a huge change in a baby's development in those first 2 weeks. So you have to allow for that and know that it's not going to last forever. And that's the most important thing, is that none of this lasts forever. It's a period of time, and it's the most important period of time in your baby's life, the first 6 months. And it feels like a lifetime, but it's such a short period of time. You know, if you think back to where you were 6 months ago, it probably has gone in a flash. It was Christmas, you know, and here we are in June. And that's your baby's first 6 months, and what you're doing, giving your breast milk to your baby, or feeding your baby yourselves, however you've chosen to do it, is the most important thing you do for that baby in the start of its life. So it's very, very short time, very, very short time, but it feels like a lifetime every hour of every day when you're struggling and you're tired, but it will pass. And you need your family around you to support you. That's the most important thing at this stage.
So Fiona's come back. She was the one with the baby that was chomping. Poor love. Yeah, just checking that was right. It was. Poor Fiona. She said, that's brilliant, thank you so much. I'll give it a try. Will the baby want less breast milk when she starts trying other foods? I just wanted to make sure I'm giving her enough. Thank you so much for all your advice. These lives have been a godsend. Thank you. Actually, when you go on to other foods, the first thing you're going to do is to give a breastfeed, and then you're going to offer the other foods, because it really is at this stage, food before one is just for fun. That's what our colleague Hannah says. So it's if you think about from 6 months to a year, breast milk is still the main calorie intake for a baby, or formula milk depending. And remember, if it is formula milk, you do not need to go on to follow-ons or any of these growing up milks. First stage formula milk is absolutely fine for the first year of life. So follow-on milks and all these other milks are a way of expanding the portfolio of milks that they have. Yeah. So actually, there is no need for anything other than first stage formula milk. You don't need to use anything else. Anyone on here is thinking about it. But regardless of whether your baby is breastfed or bottle fed, the first year of life, the main source of calories is still milk. So breast milk or bottle milk. Excuse me. So when you're going on to complementary foods, it would be a breastfeed first and then offering other foods. That's how you'll know your baby will get enough, because it will be breast first, Fiona.
You're introducing solids just to let them explore things in their mouth, and they get used to things in their mouth and different flavours and different textures, and that's good for development of speech and development of the mouth and things. But it's not for the calories at this point. It's and things like iron, so they get little bits of food for that if they're being breastfed. So it's not their primary source of food. The milk stays the same. Yeah. So food is for fun before one.
So Charlotte's come back saying, sorry about missing the chat, but Alicia had to go to the hospital for the very first night that we got down. Oh no, you poor thing, Charlotte. When we got to Devon, with the 1 year jabs were to do with it, and she was unconsolable and had a rash. Oh, I hope it's settled down for you since.
And it's so warm as well. That won't help any rash, will it?
I bet you appreciated having your mum there to support you as well. Fiona said again, as Fiona's gone, sorry to keep asking so many questions. Not a problem.
Away.
Keep going. Should I give baby water when I start introducing new foods? You don't really need to as such. You can try a cup so they get used to the idea of it, but a lot of the nutrition is going to come from you. But once they're at 6 months, you can go on to cups and things. So you could try water in the cup. You could also put express breast milk in the cup if you wanted to.
Mostly breast milk is water. 80% water.
We did that last week, didn't we?
We did. So they get all the fluids they need from you if you're feeding your baby at the breast.
But they can learn to use cups.
Sometimes babies on formula will take water if they're a little bit constipated, but they should make sure you're making the bottles up correctly, and they shouldn't need anything before 6 months other than the milk that they have. But if they're a bit older, they might want some water.
Pauline,
your health visitor will advise you.
Sorry, interrupting. Paulina's gone, thank you, I'll pass on this advice in the future. You're right, there are other ways apart from breastfeeding or bottle feeding. So, yeah. Virginia's come on. Me again. Can't tell when my baby is done with feeding and when the comfort feeding starts. Once I put him on, he feeds for an hour and rarely unlatches by himself, even though he falls asleep 15 minutes in. He wakes up when I try to pull him away, and the cycle starts again. He starts smacking his lips, asking for food, falls asleep a few minutes in, continues suckling. What can I do differently so I can get a break during the day? Nighttime he feeds for 15 minutes. I detach him, burp him, put him to bed, no problem. Replicate whatever you're doing at night, because you're obviously getting it right at night.
You don't say how old he is.
Did we find out earlier? Because Virginia's been on before. So,
I can't remember.
I'm scanning up.
Depends how old your baby is as to whether it's that, is he reaching his milestones? Is he gaining enough weight? Is he pooing and peeing normally? I would look at your attachment. And
He's 6 weeks.
6 weeks. So I would look at your attachment. Is he on really well? Can you improve that latch, and can somebody support you and watch that latch just to see what's going on there? Because he should be settling between feeds and be happier than that. It shouldn't be a battle. And he should be able to tolerate the feeds and feed properly and come off and be happy. Sometimes they get into a cycle of snacking, and that's different. If you were to put him in his pram and then go for a walk, would he go to sleep at that point? Or if you put him in a sling, would he go to sleep and wake up hungry and then feed again and see if that breaks the cycle? But is everything else normal? I think you should be having a chat with somebody.
Compressions is the other thing you could try. So while he's feeding, as he's getting sleepy, taking that really big handful of breast as far back against the chest wall, in and hold. So we're doing it as a in and hold, big handful of breasts, and whilst he's doing his suck swallow rhythm, you're holding. When he pauses, you pause. He starts again, you go again. He pauses, you pause. He starts again, you go again. And that might encourage him to take more while he's there and keep going, rather than just drifting off to sleep and then going, oh, I do want a bit more.
And have you got plenty of milk?
Okay.
If you've got very low flow, he might be falling asleep if your supply is quite if you've just got enough and you've got slightly lower flow of milk. Sometimes they just switch off when the flow goes down a little bit and they don't suckle anymore. So it might be that you need to kickstart your supply a little bit, and that might just keep him going for a bit longer, and the compressions will certainly do that. And switch him onto the other breast if he falls asleep. As soon as he starts to switch off, so he's not suckling well, or he sort of shuts down, his eyes closed, then take him off and put him on the other side before he's finished, so he gets cross and starts suckling again, and then you do your compressions on that side, and then you go back to this side, do your compressions on that side, then you take him off and go back to that side, and you switch. Get as many as you can in a feed, and that sometimes keeps them more interested and builds your supply up naturally without doing any pumping. Might help.
Okay, moving
talk
on.
Talk to one of your healthcare professionals.
It's 10 to 4, so.
Oh gosh,
yes.
You have had a good old session.
Charlotte's saying any tips on getting water into Alicia and making sure she gets enough to drink. So try different cups, making it fun,
Straw.
Leaving them lying around, not putting any pressure on her, all those sort of things. So she'll get there in the end.
Can throw around.
Yeah. So she enjoys playing with.
Spill.
Yeah. So I think let me just refresh and make sure nothing's come through again, because I have to keep refreshing.
Has done it today.
They haven't come up. They usually come up in front of us, so we
we've
know
seen
they're
nothing today.
No, well, Wendy had the same problem. Wendy said she had this the other day as well. So, but right. Well, I think we haven't any more. Just gonna check. I'm hoping it's all
We've had
right.
some great questions today.
Yeah.
Lots
All the
and
best
lots.
to you, all who've had a few problems, and yeah, and I won't ever say that a baby chomping without teeth is not painful. It is. Definitely.
I feel that
is.
bruising already.
Yeah. It's funny. Those years can pass, you can still remember it. It's like when it's on the floor. How dare you? Right. Okay. Well, thank you very much for your comments and questions, and
Same
hopefully,
time next week.
we'll be here next week. And have a good rest of your Thursday. All right.
Let the sunshine on us all.
Yeah. So and enjoy the sunshine down there in Devon. So bye.